blood supply for the hip bone it comes mainly from the internal iliac as well as external iliac and femoral arteries. The nutrient arteries enter directly into the ilium, ischemium, and pubis to nourish the bone tissue. The obtutor foramen, artery especially supplies the acetabulum and nearby areas. There is a rich network of anastomosis in pelvis to ensure collateral blood flow in case of injury. And next we have applied anatomy, in which we are just going to see about the muscle attachments of hip bone. In applied anatomy, the hip bone provides key muscle attachment. On ilium, we have gluteal muscles, that is maximus, medius, and minimus for hip extension and abduction. Plus, we have iliacus for hip flexion. On ischemium, we have hamstring muscles like biceps femoris and semitendinous and adductor magnus for thigh movement. And then on pubis, we have adductor muscles for thigh adduction, and rectus abdominis for core stability. These attachments enable hip movement, maintain posture, and support locomotion. And then we are just going to see the clinical relevance. So clinically, the hip bone is prone to fractures such as pelvic fractures from high impact trauma or acetabular fractures often associated with the hip dislocations. And also the hip dysplasia involves abnormal development of acetabulum leading to instability. Osteitis pubis is inflammation at the pubic symphysis, common in athletes, also known as the sciatic nerve, which is at risk during pelvic fractures, potentially causing pain or paralysis. And to summarize the hip bone, it's composed of ilium, ischemium, pubis, forming the pelvic girdle. The key parts include acetabulum for the hip joint, iliac crest, ischial tuberosity, pubic symphysis. Ossification starts with the primary center in the fetal period, fuses by about 25 years. The blood supply is from iliac, obturator, femoral arteries, and clinically watch for fractures, dysplasia, and nerve injuries. Thank you for your attention to this section on hip bone. We will now move to the femur. So, femur. Let's see about the femur. Welcome back. Now let's discuss about the femur in our osteology series. Again, so the femur is the longest and strongest bone in the human body. It is located in the thigh, connecting the pelvis to the knee. And also it plays a primary role in weight bearing and locomotion. It forms the hip joint proximally with acetabulum and knee joint distally with tibia. So location, we are just going to see about the location. So here the femur extends from the hip joint superiorly to the knee joint inferiorly, and it's proximal and articulates with the acetabulum of the hip bone, with the distal ends connected to the tibia and patella. It's embedded with the thigh muscles and angled slightly medial for better weight distribution. So the parts of femur, we are just going to deal with the proximal end. At the proximal end, the head is spherical and it articulates with the acetabulum. The neck connects to the head to the shaft and is common site for fractures, especially in elderly. And the greater trochanter is a lateral prominence for muscle attachments, and the lesser trochanter is a posteromedial attaching to the ilioposa. The intertrochanteric line anteriorly and the crest posteriorly connecting the trochanters. Next, we are going to shift to the shaft and distal end. So the shaft is a long, cylindrical and slightly bowed anteriorly for shock absorption. The linea aspera is a posterior ridge for muscle attachments. At the distal end, medial and lateral condyles articulates with tibia separated by the intercondylar notch. The patellar surface anteriorly, it articulates with the patella. So next we are going to see the site determination. So the head faces medially towards the acetabulum. The greater trochanter is lateral as well as prominent, and the linea aspera runs along the posterior shaft, and the medial condyle is larger and projects more distally. Orient with the neck angle medially and condyles inferior.